every style of medicine, every system has downfalls. The trick is to know what the bonuses are, the good things, and to know what the bad things are, and try and use as many of the good things and exclude as many of the bad things. And that way, I mean, that's integrative medicine really, using science and evidence and taking the best bits of lots of different styles and coming up with a kind of universal package that really makes profound changes in people's lives. I think the modern medicine, Western medicine, is very young. You know, it's only been around for 200 years compared to some of the ancient traditions that humans have been using for thousands. You know, acupuncture, Chinese medicine, these have been here for a long time compared to modern medicine. And modern medicine takes a biological view. It looks for a source of disease on a biological and cellular level, and if it can't find one, then it says there's nothing wrong with you. So you'll quite often hear a doctor saying it's all in your head, and that's the last thing they have to say. Well, actually that's true. It is all in your head, but there needs to be a way of treating what's in the head, and how that emotion is the drive to the sympathetic nervous system, for instance, that's causing all these problems for people. Irritable bowel is a really good example. It's a complex interplay of stress, emotion, an overactive immune system that's just leading to constant bowel irritability, just through the nervous innervation of our guts, which is as complex as our brain. And understanding that and getting to the root of some of those stresses or anxieties and finding ways to relieve them will directly relieve the symptoms. But when you go and see a doctor, a lot of them will look for causes that are concerning from their perspective. Cancer, malabsorption, inflammation, or infection. And when none of those are found, the next thing is it's in your head, which is, yes, it is, but that still needs to be treated. And that's where psychotherapy, integrative health, diet, exercise, you know, the causes of these symptoms might be rooted in someone's job that they dislike, or a relationship that's really bad for them, or both of those things, and drinking too much and smoking. And between those four, they have out of control irritable bowel. And if they took responsibility for those things and made the changes in their life to adapt, their symptoms would go away. And that often isn't explained, and if it is explained, it's not explained in a way that's compassionate with options for treatment, which is what people want. People want to go to their doctor and be given solutions, and that's our job, and that's what integrative medicine is, to be aware of all the different options and to choose the one that's most appropriate. And cannabis medicine, medicinal cannabis, is just one of those. And what some of us are trying to do is just prove that and say how effective it can be, and call for support from everybody to get the research done and to get people using the medicines and to get more science. And once we've done that, we can prove how effective it is and we can understand it better, which means we're doing a good thing for patients. Not all patients, it's not for everyone, not everything's going to respond to it, but the things that can, the things that maybe don't have another option at the moment, and suddenly not suddenly, it's now suddenly accepted that there is an option. That's the message we need to get out there, and that's what we need, the support from the government and patients and everyone, really.